Good afternoon. It looks like we have a few people starting to join. I just wanted to say welcome and let you know that we will be waiting to start until 4 o'clock. You can see a message in the chat, to please go ahead and register yourself by adding your name if you have not already done so. Thank you. We'll get started shortly. Welcome again, everyone. We're waiting a few more minutes to begin. If you're just joining us, if you haven't already, please add your name, first name and last, to the chat. That's how we're keeping attendance this evening. And we'll just get started in a few minutes. Thank you. And I appreciate everyone being muted. That's going to help us with our content this evening. We'll get started shortly. Hello, good evening, everyone. We'll just get started in a few minutes. Before we do, I wanted to check to see, Dr. Ohlsen, are you on the presentation yet? I don't see you, so I want to make sure we're not missing you. Okay, I know she's back to back in meetings, as you can all understand, and she will be joining. Okay, I think I got cut out there. Thank you. Good evening, everyone. I'm Stephanie Berglund, the CEO of Thread, and we'll get started in just a few minutes. We're just waiting for Dr. Ohlsen. I know has back-to-back meetings this afternoon, so as soon as she is here, we'll get started. Dr. Ohlsen, are you there? I can't see you on my screen view yet.
This is Becky. We're just coming off the school echo, so she's probably just transitioning like I was, so she should be here in a moment.
Great. Thank you, Becky. Good afternoon. Nice to hear your voice.
You too.
While we're waiting, just a reminder too, you can see the message in chat. For those who are here for credit this evening, we're taking attendance through the chat. So you can go ahead and announce your name, your first and last name there, and we'll get started in just a minute. Good evening. This is Stephanie Berglund, the CEO of Thread, and we're just going to get started in a minute. I see Dr. Ohlsen, your name showing up. Just want to make sure you're with us before we go ahead and kick off and get started.
Hi, this is Liz Ohlsen. Can y'all hear me?
Yes, we can. Great, thank you. And we can, if you're ready, I know you're transitioning, I know you have a busy schedule, we can go ahead and get started. You ready to go? Excellent.
Yes.
All right. Well, thank you everyone for joining us. Again, I'm Stephanie Berglund, the CEO of Thread, and we're so delighted to have you with us all this afternoon for a second in a special series that we're doing to help you early educators and those in our early childhood education community across the state stay connected on the latest information on COVID-19 resources and support for you. So we're really delighted to be here this evening. Our topic this afternoon is discussing health guidance for childcare, and Thread is really happy to bring that to you, of course, in partnership with our great friends at the Department of Health and Social Services. So before we start tonight, we're going to hear about a few logistics of our session from Vanessa Pleward-Smith from the Thread team. Vanessa?
Hi, welcome everybody. Like Stephanie said, just a few housekeeping. Looks like everybody is well versed in Zoom. I love seeing everybody's name. We'll just go through a couple logistics really quick. We encourage you to put your camera on. We understand that things happen, but it's lovely to see your face, and it really supports the facilitation of the training. And you're all self-muted. If you need to speak up, please unmute yourself and use the chat box as well. Myself and my co-lead Pam Walker from Thread as well is going to be here to support the chat box, attendance, as well as any other needs you might have, whether it be AV. In addition to that, this is recorded. So those of you that are participating today, you will be getting credit. You would have had your evaluation within your email that you received. So if you send that back to the email you see below, Juliana, by the 24th, which is a week from today, then you will receive credit on your transcripts and receive a certificate in your email. If you have any questions about that moving forward, please put it in the chat box. We're here to support you, and have a great session. Thank you so much.
Thanks, Vanessa. So I'm really excited to introduce our facilitator of our session tonight, Olivia Foster. Olivia, can you get a wave so people can see you on their computer? So Olivia is Thread's newest board member, one of our great volunteers from across the state. Olivia is a registered nurse, and we brought her in this evening to help facilitate us because of her great expertise and experience. So Olivia is the population health coordinator with Providence Valdez Medical Center. She has studied infection prevention and epidemiology. So all of her experience has brought her to this pivotal moment that we're all going through. So we're excited that she's here and grateful for her time to introduce our special guest and help facilitate our session this evening. So as Vanessa said, we're going to be fielding questions in the chat, and so Olivia will be our primary facilitator, but I'll be helping her along the way as well. So Olivia, I'll turn it over to you.
Great, thank you so much for that introduction, Stephanie. As Stephanie said, my name is Olivia Foster. I'm a registered nurse, and I specialize in infection prevention and epidemiology. I teach people how to wash their hands frequently and properly, as well as a number of other things. So hopefully I will be helpful for any questions that might come up this evening. I would like to, on behalf of the Thread Board, welcome Dr. Elizabeth Ohlsen. Dr. Ohlsen specializes in family medicine, and she's currently working with the State of Alaska Department of Health and Social Services on the COVID-19 response. Dr. Ohlsen is a homegrown Alaskan who grew up in Anchorage. She did her residency in Anchorage, and she now calls Anchorage home base. Dr. Ohlsen will be updating us today on the latest State of Alaska and CDC health guidance for COVID-19 as far as preparedness goes, response, and control plans. So please join me in virtually welcoming Dr. Elizabeth Ohlsen.
Thanks so much, Olivia. I really appreciate that. So what I wanted to do is spend about 10 or 15 minutes going through CDC guidance right now. And the things that I really want to highlight are resources for you all. So I think that the two things that are probably going to be the most help that I know of for all of your planning is some of the educational planning work that DEED has done, especially centered around school reopening, and then the CDC guidelines and guidance that's specific to childcare and to school. And so I'm going to kind of get started, but what I'll do is I'll post the links to some of those things in the chat box. And then I hope everybody has found the chat box, because that will also be a really nice place to ask questions. Also, please feel free to unmute yourself and jump in if you have questions. If you're thinking of it, I'm sure everybody else is, so please don't hesitate to ask, and then we'll try and leave plenty of time for questions at the end. So with that, I wanted to just kind of briefly overview the CDC Reopening Guidelines. I'll talk through those first, and then I'm not going to read much about the Department of Education Smart Start guidelines, but I want to make sure that you know exactly where to find those, because I think a lot of those are applicable to what you do. So the CDC Reopening Guidelines, they really start out by making a distinction about different places based on how much community transmission is happening in your area. So that means, how much virus is really circulating, because that determines how likely it is that somebody with the virus, somebody who doesn't know it probably, walks into your facility. And so if you're in an area with high community transmission, CDC is really recommending only opening childcare facilities for kids of essential workers, and being really, really careful if you do. Whereas if you're in a moderate community transmission zone, CDC is recommending opening for every kid, but really paying a ton of attention to a bunch of the social distancing things we're going to talk about. And then if you're in an area that has no community transmission or really low community transmission, then by all means, open for all kids, but still think about all of our social distancing measures. So, the high, moderate, and low community transmission, that's something that pretty much every school district has thought really deeply about. And so I would say one of the easiest shortcuts for you might be to identify your local school district and look at their zones. And so what they're doing is roughly translating high community transmission to their red zone, where most schools are going to be closed, moderate community transmission to their yellow zone, and then their green zone is low or none. And so if you're having trouble finding that, now is a really great time to just reach out to your local school district, because they're already doing this work, and it may be a lot easier than trying to calculate this for yourselves. What some states are doing is they're tying this directly to numbers. And I think that if you live in an urban area where you have a ton of people and a ton of data, that's a really useful thing to do. And if you live in many of our communities in Alaska, it may be too small for you to even know if there's cases in your community. And it may be, that if you live in Galena, Fairbanks's community transmission may not mean that much because you don't have people coming in and out. So that's why I'm saying check in with your districts, simplify that for yourselves. So for the rest of this, I'm going to say red, yellow, and green because it's way easier than saying high community transmission. And so when I say red, I mean high community transmission. This is high risk. There's a ton of virus going around. We got to be really careful. We're only open for kids of essential workers. So, whatever you need to keep your hospital and, the other stuff that you really need in your community open. Yellow is going to be that middle ground where it's safe to have kids in your facility, but we're going to try really hard to do everything we can to mitigate risk. And then green is really kind of when you don't have a whole lot of virus going around in your community. So every phase, red, yellow, or green, we're going to think about hand hygiene. We'll think about making sure that every staff is in a mask at all times. We're going to think about disinfecting surfaces. We're going to think about when we're disinfecting surfaces, we're keeping those products way away from kids because you can really get into trouble with that one quick. And we're thinking about the virus. We want everything to be clean, but we also need to think about all the other stuff that we think about in a normal year. And then we're going to think about ventilation. And I don't want to harp on ventilation on this because it's going to be so individual for your facility. But what I do want to say is this is a respiratory virus. Air matters. And so please talk with whoever runs the ventilation in your facility, whoever figures out whether your window's open and how much they can open for, whoever does the heat. Talk to them, get them in on this. There's great guidelines. We're not going to belabor them right now. Many of them are above my head, but your facilities people are the real experts here. Anyway, so that's the stuff we're thinking about in every phase. In the red zone and in the yellow zone, we're going to think about a couple things that can really help kind of minimize your risk. So one of the things is try and make small groups and try and not let anybody go from group to group to group. And by anybody, I mean not just kids, but staff. So if you can make little groups of 6 or, whatever's practical, and then make sure that nobody ever leaves that group, then you can ensure that people only have contact with 6 other people instead of, say your entire facility, which might be 50. That can hugely minimize risk within your facility because if you get one positive case, then you got 6 people exposed. And so in the red and the yellow zones, we're not doing anything we don't absolutely have to. No non-essential visitors, no field trips, no mixing, no big events, no intergroup events. So no events where you're having those groups of 6 do stuff together. No extracurriculars. And then we're also thinking about, how we're using our space. So closing common areas, or at least making sure that groups aren't using them at the same time, making sure the meals are in classrooms, not in some, or in rooms or special areas, not all sort of together. not sharing things, spacing out seating and bedding, make sure that the beds are 6 feet apart, head to toe, not head to head, making sure that we're staggering the arrival and drop-off times. And then the hugely critical part is making sure that all the staff and all the parents are on the same page about this stuff. And then when we're getting into that green zone, that's when we're still trying to do all this stuff. It's just, if you can't do this stuff, it might not mean the difference between keeping your facility open and having to close your facility. In the yellow zone, if you're not able to do this stuff, it may not be safe for you to be open at all. In the green zone, that's sort of our do our best zone, if that makes sense. And then, I wanted to go over some of the specific stuff around hand hygiene. I think we all wash our hands when we go to the bathroom, but this is a time to totally rethink how we do hand hygiene. So, I mean both hand washing and hand sanitizer. The things that are working for you. Obviously, if you're going to the bathroom, wash your hands with soap and water. But for other things, hand sanitizer is a reasonable alternative in most cases. And you want to be cleaning your hands when you get there. When you're taking a break, anytime before and after you prepare food or you eat food, you prepare drinks or you eat drinks, pretty much anytime you get anywhere near a child. Especially before and after diapering, and that's another wash your hands scenario. It's not a, hand sanitizer is going to cut it kind of scenario. Similarly, anytime you're dealing with other body fluids, that's a wash your hands kind of scenario. And then, if you're going outside, many places will actually have people hand sanitize anytime they're coming in or out of a room. So just making sure, especially, if you're setting things up in a facility, making sure that that's really readily available. And you have sort of that added dimension that you have to make sure that it's available for adults and not for kids. So really thinking through kind of how this is going to work with every single interaction is going to be really critical. And then figuring out how to wash kids' hands. So I know we do this. It's really hard to do. I've held a toddler up and washed their hands. It's not easy, but we do have to kind of find a way to incorporate that in everything that we're doing. And then, I just wanted to really quickly talk about all of the other considerations. I'm going to go really fast through this. So please, this is only an introduction. This is something that I think we should all read a few times, and that you should, have a chance to get a lot of information about and see what Alaska is doing and see what CDC is recommending. But essentially, first of all, think about symptoms, think about fever. So when the kid gets dropped off is a really good time to check for symptoms, check for fever, especially if you can do it before the parent leaves, because it gets really tricky if the parent leaves. And then you've got yourself a whole different situation. Similarly, anybody who gets sick, staff or student, they have to be isolated, they have to go home, you have to clean any area they were in. You can't wait until the person turns positive, you have to kind of clean right then. And then CDC guidelines say ideally close the area for 24 hours. That may or may not be practical. The important thing is to get it clean. And have people move out of there while you're cleaning, at least. Another thing that's going to be really critical is keeping a record of who is around who else. So we call this contact logs. And what you do is each staff member will write down anybody that they were within 6 feet of. And remember, exposure is cumulative, so it's 6 feet for 15 minutes, but if you were within 6 feet for 5 minutes 3 times a day, then you've already hit your 15 minutes. So each staff member should keep a log of anybody they're around, any kid, any staff member, any visitor, anybody else. And then you should do this for every child. And so if you're cohorting really tightly and you have kids in these tiny little groups and they never, ever, ever get near anybody else, then you can keep one for that cohort. And so then you just have to keep track of who's showing up in that cohort every day. But if your kids are kind of getting a little more casual about that, or you have kids wandering around, then you really have to keep an individual log for every single kid. And so you want to keep these logs for 30 days. You want to update them every single day. And so this will do 2 things for you. One, God forbid, you have a case in your facility, you'll be able to see at a glance who you need to call right then and say, hey, keep your kid home. You've been exposed, you need to quarantine for 14 days. But the other thing that I think is so useful is after you do this for about a week, you have a really accurate impression of like what your risk looks like within your facility. So if you're having contact logs that are pages and pages and you can't keep track and it's a huge burden and you're writing down a million names, then that's a good trigger to really reevaluate how you're doing things. These contact logs are a reminder of who you'll have to quarantine if one of those people gets sick. Conversely, if your contact log looks exactly the same for every person every day, it's the same 5 people, then you know that you're really minimizing risk. So I'd really encourage you to make this part of your practice. And then going along with that, making sure that everybody knows who to call if they are sick. Everybody has sick leave, super critical. Not everybody has it, super critical though. Because you do not want a staff member wondering if they should come to work that day when they have symptoms. There's no symptom that's too mild to be COVID because so many people don't have any symptoms at all. So you can't really wait it out. You can't come to work with 3 days for something mild. Folks really have to be able to make the decision to stay home. So anything your facility can do to encourage them to make that decision to stay home, to make that choice for themselves, for the family, for your facility, that's going to pay dividends in the long run, even though it for some of you, it may be a huge change from your practice. And then, parent education. So staff need to know who to call if there's symptoms. Parents need to know who to call. Parents should tell you if their kid tests positive. Parents should tell you if their kid is being tested. And obviously not come to daycare while they're waiting on a test. They should tell you if their kid's been named as a close contact. If you get a call and they say, well, my husband has COVID and that means my kid's a close contact and so we're all quarantined, you do not have to quarantine anybody in your facility. You guys are good, unless, the husband came in, obviously. But it's good to know. You want to know that kid's going to be out for 14 days. And you also kind of want to keep it in the back of your mind that there's been maybe a little bit of something there. So just, obviously watch everybody really closely. But fortunately, you don't have to quarantine the contacts of contacts. So that's kind of second degree contact. They don't need to get quarantined. So your staff, your student, your other kids, they don't have to go home. Making sure that parents are really clear on when a kid can come back after they've had symptoms. It's not when their runny nose goes away. It's a lot more complicated than that. They need a negative test or a note from a doctor, or they need to be out for 10 days. And that's sort of the broad strokes. There's more specifics than that. But it's super important that parents understand that this is not a normal year. And then, because it's not a normal year, you may find that things change very quickly and that you have to be ready, just like the drop of a hat. You get a phone call, a staff member's been sick for the last 4 days. This happens every now and then. And so you basically have to be prepared to call everybody, maybe even to close your facility for a few days, to investigate everything, to clean everything. You have to, parents have to understand that if their kid gets sick or if their kid is a close contact or if something else happens, they may need to go without daycare for 10 to 14 days, which is a pretty daunting prospect. But it's not a normal year. And so really trying to have everybody on the same page that things can really change in an instant and that your facility sort of has to be ready for some unexpected things to happen. And what schools are doing is not only are they planning for that, but they're preparing communications beforehand. So like they have that email ready, they have that phone call ready to go to their phone tree. They have everything ready that they need to do to say, look, for everybody's safety, we have had, something happen, or for safety reasons or whatever. You don't have to give individual details, but you do have to communicate that people need to that daycare is closed or that they need to quarantine. And that information has to be communicated really quickly. And then the one other thing I want to mention. So I've worked in hospitals during this pandemic, and we are all really conscious of protecting ourselves against any germs the patient has, and we're really bad about protecting ourselves from each other. So what I've seen in ERs across the state since this pandemic starts is everybody's really good about their mask until they walk into the break room and then the mask come off. And so helping staff understand that they have to protect themselves from each other, and helping staff understand that the break room is not a COVID-free zone necessarily, that's also going to be really crucial. So that was a little longer than I wanted to go. That's the big stuff. That's the highlights. I just threw a ton of information at you. Please tell me what things come to mind right away, what questions, and I will start posting links to resources.
So Dr. Ohlsen, there were a few questions in the chat box. The first question was if you could explain close contacts.
Yeah, so a close contact, we use a specific definition, and this is the definition that the CDC uses when they're tracking these cases. So they say within 6 feet for 15 minutes. And so, and they also include sort of significant contact. So if it wasn't quite 15 minutes, but you changed their diaper, probably you're going to be considered close contact. Again, it's cumulative. So if you were within 6 feet for 1 minute, but 15 times a day, then that's going to count. So close contacts are the only people that need to quarantine if a person is positive for COVID-19. Their relatives, their contacts, they don't need to quarantine, but folks who have that close contact type interaction with somebody who has COVID-19, they need to quarantine.
Great, thank you for that question and for that answer. The next question in the chat box was if you could discuss isolation versus quarantine.
Yeah, this is such a good question. It comes up all the time. So I think about the quarantine 14 and the isolation 10. So, and the way I think about this is baking cookies. So for quarantine, so I have an old oven. It takes a while to heat up. Sometimes it doesn't heat up at all. So quarantine is like when you've turned on the oven and you're trying to see if it's going to heat up, and it takes a while. So what we're doing during quarantine is somebody's come into close contact with the virus, and we're trying to see if they get symptoms. We're trying to see if they have any signs of actually getting COVID-19, because not everybody that comes in contact with a case gets it. So we're keeping you away for 14 days. And the reason it's 14 days is because it takes 2 to 14 days to develop symptoms. So we're waiting to see if that oven gets to 350 to sort of torture a metaphor. And so isolation is when the cookies are already in the oven, they're baking. So that virus is in your system, it is cranking away. It takes probably more like 5 to 8 days to get the virus through your system and get your system to really take care of that virus. We let it go to 10 days because 10 days is sort of a safe number of days to start being around somebody who's had COVID but hasn't been so sick that they need to be in a hospital. So we isolate people who have COVID for 10 days, but the quarantine is 14. And so the important thing is, if you have COVID, you can actually go back to work sooner than your close contacts.
That was a really great explanation. I appreciate that. I missed a question about the indoor. Can you share thoughts on creating an indoor gross motor space for young children to get some much needed exercise and movement?
I'm so glad you asked, Christy, because that is so important. Finding ways to get everybody exercise, finding ways to get people moving. And in Alaska, finding ways to do that indoors. And so, the things I think about, and you're going to get sick of me saying this, are ventilation and space. So the more ventilation, the more open windows, or whatever your facilities say is going to work, the better. Outdoors is, of course, the best. Naturally very well ventilated, especially in windy places. But if you're indoors, trying to find places where you've got great ventilation and plenty of space. And so what many schools are doing is, instead of having the whole class go out to recess or the whole class be in the gym, they're taking half or they're taking a quarter and putting them in a space so they have plenty of space to spread out, still move, but without being all over each other. The other thing is, with younger grades, in younger ages, they have a lot of trouble with the concept of staying 6 feet away. We're social creatures. It's very normal for us to want to be close to each other, especially kids. So that's where keeping your groups tiny and really tight and not mixing with anybody else is going to be super critical, because you may not be able to keep your 3-year-olds from licking each other, but you can keep them from licking kids outside of their group, which is the super important part.
Great. The next question is, the CDC has moved from a symptoms-based return versus the test-based return. And can you kind of go into that a little bit more detail?
Yeah, definitely. So this has been, I feel like this change is really super useful. So what we were doing before is we were saying, well, you have to wait this number of days, or you have to get this number of tests, or, and then, but one of the many problems with COVID, and one of the reasons that this is such a tricky thing, is that some people, when they have COVID, test positive for like 10 days. And some people, when they have COVID, test positive for like 4 months. And it doesn't mean that they're contagious for 4 months. So the way our tests work is they look for itty bitty scraps of virus. They don't look for contagious virus. They just pick up the scraps. So some people have scraps of virus kicking around in their bodies like forever. But they're not contagious. So should we keep these people out of school, out of work for 4 months? No. And the reason we're confident about that now is, like 7 months into this thing, we're pretty solid on that. In March, we were like, oh, these people are still contagious, maybe, I don't know. But now we're pretty solid on that one. So because we used to say, well, test negative twice in a row and you can go back to work. And we had so many issues with that. Now what we do, now that we're confident that you're not contagious after 10 days, we say, okay, don't worry about the test. You don't need another test. Save the test for people where they're useful, like people that we don't know had COVID. Instead, just come back after 10 days.
Great. Do you recommend coming back after 14 days with a negative test, or do you recommend coming back after 14 days, or is a negative test enough?
Monica, this is a great question. Let me break it down so I make sure that I understand it. So there's 2 situations here. One situation is the quarantine situation. So quarantine is a 14-day thing that happens to you if you've come in contact with a case. And quarantine is a jail that you can't get out of for 14 days. A test can't get you out. There's no pass go, collect $20, tortured monopoly metaphor. You can't test your way out of quarantine. You are stuck for 14 days. And so that's kind of where we are with the quarantine. For isolation, and so this was what we were talking about with the symptom-based return. So if somebody has symptoms and they test positive, or even if they have no symptoms at all and they test positive, they have to isolate for 10 days. And so at the end of that, we don't test them. We just say, okay, it's been 10 days. You're not contagious anymore. Come on back.
Kimberly Carlson asks, what are the recommendations for kids who are 3 to 5 years old with regards to masks?
Yeah, that's a great question. I'm glad you asked. So CDC recommends that masks should not be worn by kids under age 2. So that means the kids 3 to 5, masks are actually, they're totally fine and they're recommended. Not all places require kids 3 to 5 to wear masks, and the places that don't require kids 3 to 5 to wear masks should definitely be aware that, all of the other things, they're really going to rely on everything else that they're doing. In Oregon, they've taken a different tactic, and they've required masks for every single person in the state over age 2. And so there are certainly places that recommend masks in age 2 and above. And the logic behind age 2 is really, you don't want to put a mask on anybody who can't take it off on their own. So, if you have an ear loop mask around a 2-year-old, then if they don't like it, they can just take it off. If you're tying it around their head, so I think it also makes sense to think about the kind of mask you're putting on a kid. So if you're tying something around a kid and it's tied back here and they can't reach it, not only is that a potential strangulation hazard, but, it's not going to be easy for them to take off on their own. This is not in a CDC recommendation, but when I think about it, the sort of thing that I would put on a child, a 2-year-old, a 3-year-old, a 4-year-old, is the kind of mask that just goes over your ear and that's really stretchy, like a surgical mask or one of those cloth masks that has ear loops where that kid can just rip it off if it's not their thing. A 2-year-old may not keep a mask on for very long, although I have certainly met 3, 4, 5-year-olds who are in love with their masks. It's how they're going back to school. It's how they're going back to daycare. It's part of their pathway back to a normal life. They are into it. So, you may be really surprised by what these kids will do.
Can you talk a little bit about face shields with a face covering?
Yeah, so face shields are great eye protection. They don't replace a mask, because what a mask does is when you're talking, when you're breathing, when you're doing all of the things that create respiratory droplets, not just coughing, talking and breathing do it too. What a mask does is prevent those respiratory droplets from going into the air around you, going to the person in front of you. And a face shield is super great eye protection. It keeps respiratory droplets from other people coming onto your face. I wear these big glasses. Not everybody elects these super fashionable statements. So, you may want that face shield in certain circumstances, but it doesn't keep your respiratory droplets from moving around. So, what many people do if they want eye protection and respiratory protection is they wear a cloth mask and a face shield. Some people want people to be able to see their mouth. And so if you're working with small children who are learning to talk, it can be really nice if they can see your mouth. So the 2 good options available that I know of are there are cloth masks that have clear plastic windows right here. And so this is what a lot of our ESL teachers are using in school. This is what a lot of our speech therapists are using in school, are these masks that have plastic windows. The other possibility is there's, and I do not have a financial interest in this company, but there is a company in Juneau that is making a face shield that has a droplet barrier. And that droplet barrier goes all the way to your collar, and it catches all that stuff that you're breathing out and that you're talking. I think it's called the Humanity Shield. You'll have to double check me on that one. Again, I'm not endorsing their thing, but it is another thing that that some teachers and some therapists in schools are choosing to use. So that would be another reasonable option that would actually replace a mask. That would be the face shield with the droplet barrier, and you don't have to wear a mask with that option.
The next question is from Pamela DeGreat. I'm a home child care instructor, and I have the same 8 children all the time. Do you feel that they still need to wear a mask?
So Pamela, that's such a good question. Let's talk through this a little bit, because this is a tricky decision that you have to make. So with 8 kids, that sort of means that we have like 8 opportunities to bring virus into your home. There's 9 of you total if you're involved as well. So what you're doing is trying to decide if a mask adds enough value to sort of your whole protection plan that it's worth it. And so, I think of masks as something that's relatively easy to add to your protection plan to add another level of safety. And some people are saying, well, I'm able to really have 6 feet in between everybody at all times. My daycare is entirely outside, and there's some other reasons why they may not need that level of protection. But I think at this point we could use all the protection we could get. I also want to talk a little bit about sort of like how risk multiplies. So say if your 8 children each live in a household that has an average of 4 people. So that means that if you yourself have an average, have a household, and households look like all kinds of different things, but for convenience sake, let's say 4 people. So you have 9 people. 9 times 4 is 36, I'm pretty sure. So now you have like a cohort of 36 people, right? Because each kid is going to be exposed to everybody at home. So then when you're in that cohort of 36 people, that means that, you have the kids that are in your house, but you also have their parents and any other siblings or grandma and grandpa or whoever else is living with them. And you're kind of subject to the decisions those people make. You might not even know them. And, if somebody like goes and sees another friend or, goes to a party or goes to a bar or goes to a work event that has 50 people, then the entire cohort of 36 people suddenly assumes that risk. And so you can kind of see how that just really expands really quickly. So that's why I would recommend using every chance you possibly can to try and reduce that risk.
Thank you. The next question is from Ingrid Reese. Being that COVID-19 is proving to be airborne, why is 6 foot the magic number? What happens to the airborne virus within that 6 foot radius or space?
So Ingrid, I'm glad you asked that. So I want to think about the term airborne for just a little bit because it's used in a lot of different ways. So in healthcare, we have like these very specific definitions between airborne and contact and droplet and that sort of signify a category that a disease is in. I don't think these definitions are super useful outside of healthcare. In healthcare, we use it to make decisions about, like what kind of ventilation do you need and what kind of mask do you need. But for practical purposes, I think it makes sense to think about respiratory viruses as a spectrum. So some viruses, you really have to cough on somebody and like get their spit in you to have enough virus to get sick, right? And some viruses, like measles, you just have to be in a room that somebody was in like 4 hours ago, and you can be on the other side of the room and the window can be open, and gee, if you're not vaccinated, you're still going to get measles. And so there's kind of like this continuum between like, stuff that's kind of hard to get and stuff that's kind of easy to get and stuff that, the droplets are so big that they're like bowling balls and they immediately fall to the floor. And measles, which like hangs out in the air and like flutters around for hours and hours and hours. And so COVID's somewhere in the middle, right? It clearly doesn't immediately drop to the floor, but it gets there eventually. And so fortunately, it's not like measles. So what that means for us is that a lot of droplets from COVID, even if you're not wearing a mask, fall to the floor pretty close to you, about 3 feet away. So if you're not wearing a mask at all and you're just talking and breathing, then about 80% of your droplets fall within 3 feet of you. And if you're not shouting or singing or projecting your voice or playing a trumpet and you're just talking and breathing normally, then at 6 feet, it's about like 95% of your droplets hit the ground before they hit somebody 6 feet away. And then at 9 feet, so you add another 3 feet on there, it's like 98%. So like there's nothing magical about 6 feet. It's just kind of a guideline that we're trying to get everybody to think about. Because if you say, well, my risk is 88% if I do this, but it goes down to 54% if I do that, it just gets totally out of hand. So Just think about 6 feet. Now, if you have a mask on, it catches a lot of the big droplets. And it catches some of the little ones too. So what that does is it further decreases your risk. And so, I'm not going to do the math for you because I don't think it would be useful. And also I'm not sure I can do it in my head to tell you exactly how, what the mask versus this type of mask at 6 feet is exactly. What I am going to say is I think you reduce your risk significantly if you stay 6 feet away and you wear a mask.
Sorry about that. If a child or classroom needs intervention or observation, are those allowed to happen either from within the school or from outside the organization? And that comes to us from Christy Behag.
Thank you for asking, Christy. So I don't want to step too far out of my wheelhouse here. So what I want to do is give you my best answer from the CDC guidelines. And then if anybody else has more info on this, because I don't actually know exactly what intervention or observation entails, then please jump in. But so when I'm reading the CDC guidelines, I think about whether we're in the red level, the yellow level, or the green level. And the red and the yellow level basically say, really don't let visitors in. So maybe observation or intervention is something that can happen via Zoom or another remote learning technology or another remote technology. And in which case, 2 thumbs up. Bringing another visitor in may not really make sense. In the green zone, it might be something that's a lot more reasonable. Anybody else got something on that?
I think that was a pretty good answer. Yeah, do what you can to accommodate virtual meetings and try to keep your space as limited to the cohort of people that you have within it. But sometimes entities like Child Protective Services might have to come on site and actually visit. So when they get there, I would just recommend make sure that you do an attestation with them, just asking, have you had any signs or symptoms? Do you have a fever? Make sure that you validate those things and then make sure they're wearing a mask and trying to keep their distance. If they have a face shield, have them wear that as well. And lots of hand hygiene all the time. Protect your kids.
And I want to take this opportunity to also say that your staff meetings should be virtual. Please try to find a way, or really spaced apart. But anytime you're getting all your staff in a room, that is such a high risk situation.
The next question, I hope we answered that question. If not, go ahead and write something in the chat box and we'll try and address it better for you. If a child doesn't like to wear a mask, can you force the child to wear a mask? And that question comes from Liza Newell.
Liza, I'm glad you asked this. So I guess the way I think about this is I'm not an expert in early childhood education, and I feel like you guys really are. And so I think of encouraging a child to wear a mask as being sort of a similar discussion and negotiation, if you will, as having a child wear pants. And so what I would love to do is have you guys share some of your strategies that you've learned over the years for getting a child to wear pants. I definitely don't want to say force kids to wear masks, but it may be that there's situations where it's more or less inappropriate for a child who's not wearing a mask or a child who's not wearing pants to interact with other children. So I think sort of the same strategies that you'd use for like redirection of kids and, educating kids and maybe separating them while they need a minute, and all of the other things that you guys are way better at than I am, I think that would just apply to all this stuff too.
Earlier, you had mentioned that when staff are sick, it's really important for facilities to be able to provide paid time off to incentivize people staying home when they're sick. Do you know if there's public health assistance that can help some of these smaller facilities accommodate those kind of things to keep staff home when they're sick?
That is such a good question. Unfortunately, I don't know off the top of my head. Let me write that down and see if I can find out more about it.
Dr. Ohlsen, this is Stephanie. I wanted to jump into that too, and would love to hear from others who are with us tonight. And I was going to ask something similar, Olivia, that for most of our early educators across the state, unfortunately, most of them don't have benefits, including health insurance, and so therefore don't always have a primary health doctor or home. And so just wondering, you know, if you can in your notes also remark and loop back about other just health supports, teledoc resources, public health, even testing. I know we talked about that earlier, which I really appreciate the clarification on that, but I know other sectors are using regular testing, such as senior home facilities and that sort of thing. So I don't know if you have other thoughts about that, or could connect us to some other resources. That would be great.
Certainly. So let me take a crack at some of those, and I'm going to miss at least one of them. So please let me know. So in terms of sort of that situation where folks don't have ready access to care or testing, or they're not sure how to get access to care or testing, this is such a individual community thing, because the resources do look totally different in different communities. So, you know, one of the things that I would encourage folks to do is to explore the options that are available in their community, including any local or any local public health, in terms of especially getting tested when you don't necessarily need medical care for COVID symptoms. I don't want people to have to go to the doctor unnecessarily. What I would like to be able to do is have testing that's readily available for folks who aren't so sick that they need to go to the doctor, but do need to get tested. And so your local public health folks can be a huge resource for that. Going along with that, some communities have found ways to arrange testing that is low or no cost to the individual, especially if the individual does not have insurance. Most insurances do cover COVID-19 testing, but again, this is so sort of individual among communities. So knowing your community resources are going to be kind of crucial there. The other big question I heard you ask about was, basically, should we be doing testing like the nursing homes are? So what nursing homes are doing is, because they take care of an exceptionally high-risk population, they are required to test their staff regularly, periodically. And so this is a question that comes up a ton in relation to schools. And so currently CDC does not recommend any screening testing, any regular testing of asymptomatic people in schools or daycares. And the reason for that, so there's kind of two things going on here. One is sort of, the likelihood that somebody has a positive test or a case of COVID-19. Somebody has the virus in your facility and doesn't know it. And then the other one is the risk. So like what is the worst case scenario? And so the likelihood, if you're a daycare in Anchorage versus a nursing home in Anchorage, that one of your staff shows up with COVID-19 is probably pretty similar. It's a little more complicated than that, but let's go with probably pretty similar. The risk of the worst case scenario of what happens when a person shows up, a staff member shows up with an asymptomatic positive case in a nursing home versus a daycare is different. Now, there's a ton of qualifications that go along with this, and the what if grandma's at home is a very, very valid thing. But in a disease that has a huge mortality rate among old, frail people, CDC has decided to have totally different recommendations for staff in nursing homes than it has for staff in every other congregate facility. And so, one of the reasons for that is a third of the deaths from COVID, more or less, approximately, in the US, have been in nursing homes. So that is why we are targeting nursing homes and testing very aggressively. And so the worst case scenario for a case in a daycare, I don't want to minimize this. It's not nothing. There's definitely some bad worst case scenarios, but it is, in terms of the like cost benefit, and I don't mean monetary cost, but just sort of like should we use a lot of tests on asymptomatic people, or should we really prioritize testing really symptomatic people? Cost benefit balance doesn't swing in the balance of testing everybody who works at a daycare or a school all the time. The other thing is, when you test, it only gives you a tiny snapshot. It only tells you what's going on that day. It does not tell you about exposure. It doesn't tell you about what's going to happen the next day. So if you're testing, when we're testing in nursing homes, we have to test everybody all the time. And so, I wish we were at a point where we had a super easy test that we could go to every single person in the US every single day. And that would be great. And I would love that. Until that happens, unfortunately, we have to make really tough decisions about who should we test. And so that's kind of where the balance falls out for schools and daycares right now.
The next question comes from Maria Eugenia Rojas Ayala, and she is wondering, is it recommended for kids to play outside with a mask on?
So I don't have a straightforward answer for you, Maria, but I want to kind of talk you through my thinking. So when kids are, so I want to start out with the highest priority time for kids to be wearing masks is when they're indoors and close to each other. Probably among the least high priority time for kids to be wearing masks is when they're outdoors and far apart. I think definitely if you can space kids apart and you're outdoors, then masks aren't going to give you that much of a benefit. If your kids are 10 feet away from each other, then a mask isn't going to add a ton to what you're already doing. If your kids are 1 foot away from each other, it might still add a lot to what you're doing. So it just kind of depends a lot on what's going on. It's a reasonable thing to have kids play in masks. For years, I've recommended that some of my asthmatic patients run in masks, especially when it's cold or it's dusty. It absolutely can be done. I regularly exercise in a mask because I have asthma. This is a total digression, but I want you to know that there's not like a health reason that you can't wear a mask and run around. It's just inconvenient. The other thing I want to be really clear about is that if a mask gets dirty, soiled, wet, it has to be changed. So pretty much every kid, when they go outside and play, is going to need to change their mask to a new mask when they come back
in. The next question comes from Monica Ledren. What do you think of reducing hours of operation to mitigate as a mitigation measure?
So I think it depends on what else you're doing and what your intention with that is. This is going to be such a personal facility-based decision. So if what some schools are doing is they are dividing their days into half days for everybody. And they're having half the kids come in the morning. And the reason they're doing it is so they can have half as many kids in a classroom at a time. And then they're having the other half of kids come in the afternoon, and again, like half as many kids. So if one of the reasons that you're doing it as is to kind of have more space or to better use a limited amount of space, then maybe that does make sense. How that works with sort of providing childcare and interacting with the hours that parents need childcare is super far out of my wheelhouse and much more in yours. In terms of going from 8 hours to 6 hours of childcare or going from 6 hours to 4 hours of childcare, that probably doesn't make as big of a difference. Does that kind of make sense?
Yes, that makes sense for sure. With regards to masks, where would you say during the day, like, should we encourage people to have everyone label their masks with their child's name, kind of like they do with their clothes? And then when you eat lunch, where should kids be putting those masks, and where can we store masks safely?
Yeah, these are great questions. I think 100% we should have labels on masks because we don't want kids sharing them. I also think that we should have plenty of masks for each kid. So, you know, kids probably aren't going to use one mask in a day. They might need 3 or 4. And so the mask should be, of course, washed between each use. Probably, you know, schools will want to have some extra masks around because, you know, kids will forget theirs, or they'll go through 6 in a day, or, you know, something else will happen. So it's going to be really nice to have some extras. In terms of taking them off, putting them on. So what some schools are doing is they have pencil cases, like kind of big ones, for each student, and labeling those with a name. And so, you know, if you have a hard plastic pencil case, that's something you can clean easily. You can put the kid's name on it. You can have it in a place that is their place. You can have some extras in it. So I think that that's a totally reasonable approach. I do want to talk a little bit about the situation where more than one kid takes their mask off at a time, or really anybody takes their mask off while they're around other people. So in the school districts, we've kind of talked about this concept of a mask break where, you know, parents were really worried that their kids were going to have a hard time keeping masks on. And so they wanted a time during the day where the kids could all take their masks off. And so that can't happen together. Because if you wear a mask for 6 of the 7 hours a day and then you take it off for an hour a day, it's like kind of like you weren't wearing it at all. So what you do is, if a kid, you know, really is not doing the mask thing right then that's a good time for them to kind of go to another space where they can be away from other people and they can take a mask break, but not around other people. Fortunately, what we've seen in other places is even young kids actually get used to masks really fast, typically much faster than adults do. It's sort of the new normal for them, and they are actually able to tolerate it pretty well after the first few days. Folks who taught in Taiwan where they required masks found that it took about 2 days for kids to get used to wearing a mask all the time. So for lunch, what some districts are doing is they're finding ways for kids to eat pretty far from each other. So at least 6 feet, but often much more than that. What other districts are doing is they're finding ways to, like, have half the kids go outside while half of them eat, and then switch to have fewer people in the room. And what other districts are doing is they're putting up like plexiglass or shower curtain plastic, or, you know, whatever, plastic barriers in between kids. So they're kind of giving them a place where they can take their masks off, but protecting them from, like, releasing respiratory droplets towards other kids. I see a couple questions about kids touching masks, and then I definitely, great to clarify. So please don't have kids take a dirty mask off and put it in a case with other clean masks. So maybe that's a good dirty mask bag, clean mask case, or you know, some other way to configure that so it makes sense. And I know you guys are really creative, so I'm not going to tell you what to do there. And then in terms of keeping kids from touching their mask, it's an adjustment period. I think we all have trouble remembering that. I think the really important thing is to try and get in the habit of washing or sanitizing your hands before you and after you touch your mask. So if you see a kid touching their mask, it's a good time to sort of remind them that the expectations are that they not touch their mask, and also to wash their hands. And it's definitely going to take some coaching. I think it takes coaching for all of us.
Would you recommend, when parents drop their kids off, that they come into the facility, or would you try and accommodate something where they can kind of do like a front door drop off to help mitigate exposures?
That's such a good question. So thinking through that, I kind of see two sides. And one of the sides is you want to try and not have extra people in your building. And the other side is you want to make sure that you get through that screening before the parent leaves so that if kid has no symptoms, but oops, had a fever, then you can kind of hand the kid back. And so, this is going to look different for every facility, but if you can find a way that you sort of have like that intersect in like a clean way where you can like maybe do a screening in a tent outside. That's what we were doing at one of the clinics that I worked at, or, whatever works for you. We had like an event tent, a couple chairs and a thermometer. But whatever works for you guys, but just trying to sort of make sure that we get that sort of intersection of needs right. I definitely think that it's a great idea if you can minimize the people coming into your actual building.
Can you please explain to the group about symptom screening and CDC recommendations? And that's from Erica E.
Yeah, thanks for asking, Erica. And I want to preface what I am about to say with that CDC recommendations have changed a couple times on this. And currently, my understanding of the CDC recommendations is they're actually a little bit different for schools than for other places. And I don't fully understand why that is, so I'm not sure I can comment on why that is. I can tell you how to do a symptom screening, and I can tell you that I think it's a good idea. And then CDC sort of recommends, but also doesn't necessarily recommend doing this. But in terms of symptom screenings, what it actually is it's asking parents, has their kid had any of these things happen in the last 24 hours? Have they thrown up? Have they had diarrhea? Do they have a new rash? Do they have a new cough, runny nose, trouble breathing, fever if they know, other stuff going on. And so whether that's asking parents right when they get to school, or it's asking them via an app beforehand if you have a really slick setup, or if you think that your parents are really on top of things and they want to do it on their own every morning, I think any of those things are acceptable. And so what CDC is saying for schools right now is that parents should do it on their own. So schools don't have to necessarily check every single kid's temperature and ask every single kid about symptom screening. But, because you're not dealing with high school students, you're dealing with younger kids, it may be that that really, having a one-on-one conversation with the parents might be your default unless you're able to make other arrangements. And the other thing I want to mention is that it is not super uncommon for a kid with COVID to have a fever and no other symptoms. So, normally when kids have fevers, they look bad. Their eyes are all glassy and they're tired and there's other stuff going on and they're fussy. And sometimes kids and adults with COVID have fevers and you would never know it. So that's why we actually check. What might work best for your facility and what some school districts are doing is they give every family a thermometer and say, use it every morning. And what some school districts are doing is they are checking at their door. And I think you can kind of see what works for you. But, it certainly, I think you know your parents a lot better than I do. You know your kids a lot better than I do. So I think I don't want to tell you what to do there. I do think symptom screening in some form is a really good idea. And then Carissa wanted to know more about symptom screening and sort of like normal kid stuff. So we definitely get into the weeds a little bit on this with schools. And so one of the things I think about is CDC says new symptoms. So anytime you're seeing that list of COVID symptoms, at the very top of it is saying these symptoms are new. So if these are new symptoms, they're symptoms that a kid should be excluded for. The exception is if they have a note from a doctor saying, this kid's teething, give it a rest. Or this kid has allergies, they sneeze every single day, it's not COVID, they should be allowed to come back. But this is not a normal year. And one of the things that schools are really struggling with is you kind of have to exclude kids that have, you know, all kinds of stuff. Because, you know, it's not really unusual for kids to have stuff going on. Somebody told me once that daycare aged kids have an average of 12 viral illnesses a year. So that's either 12 COVID tests or 12 10-day isolation periods a year, which is pretty daunting if you think about it. That's like more than half the time they spend with you. So, so this is not going to be easy. I don't have an easy shortcut out of this. I do not have a way to distinguish clinically between a COVID symptom and a not COVID symptom if it's one of the ones on the list. I do not have a way to say that fever went away in a few hours, so it's fine. I don't have a way to say he only threw up once, so it's not COVID and he's fine. COVID's tricky. 40% of people have no symptoms at all. And so I wish I could say, like, you know, sometimes I say for the flu, they're not that sick, we don't need to test them. But I can't say it for COVID. And Donna, I completely hear you that parents, you know, that from a parent's perspective, you got to get your kid to daycare because you got to get to work. What on earth are you going to do if your kid has a symptom and not just can't go to daycare today, but can't go to daycare for 10 days or until you get them a test? Like, that is a huge, huge thing. I don't want to minimize it. I also don't have any easy answers. This is not a normal year. We're in the middle of a pandemic. This is really, really tough. And you may find that when the Tylenol wears off 4 hours after the kid's been there, that they have a fever. And so having that plan for what you're going to do, putting that kid on isolation, cleaning things, calling the parent, having somewhere where that kid can be, where they're not around other folks, waiting for their parent, even if you're not able to reach that parent for a few hours. And I know that that's part of a reality. But that's kind of where we are. And I think, you know, part of this is especially parents that have daycare age kids and don't have school aged kids yet, they may have a lot more trouble with this. The parents who have kids in school have heard about this non-stop for at least the last few months. And they're going to have sort of some inkling that, you know, things could go south really quickly for them if their kid has a symptom. You may find that your parents who this is their older kid or this their only kid are not as familiar with the symptom-free zone thing. And so as much parent education as you can do early, especially, you know, scenario planning, really laying it out for people. Like, if your child has a symptom, they must stay home. If they're found to have a symptom, they must go home. They can't come back for 10 days. The more you can kind of, you know, help them understand that early, it's not going to make any of this easy, but it might make it easier.
Thanks, Dr. Ohlsen. This is Stephanie again. I was wondering if you can talk a little bit more about that we currently Anchorage has mitigation plans required for childcare programs at this time, but we don't at the larger state level. So to building off the conversation and the thoughts you were just sharing, can you talk a little bit about, like, just a scenario, you know, when a child is positive or a teacher is positive, what you would recommend or what you're seeing in other small businesses, you know, that may be a practice of what they do. Are you know, should they close? You know, how do they reopen? You talked a little bit about, you know, sanitation and contact, but when it's actually happening, you know, to, you know, their direct staff or customer and student, you know, I was wondering if you can just talk through that a little bit.
Yeah, definitely. And please let me know if questions come up while I'm talking about this. So I want to address that specific question. What do you do if somebody's found to be positive? And then I also want to kind of put that in context of how our testing is looking right now and how we may not have the luxury of waiting for that positive test. So first, it's 10 p.m. and Molly's mom calls you and says, hey, that sniffle that Molly had for the last couple days, it's probably been going on for a couple days, maybe just kind of off and on. And then, gee, today it was really bad. So I kept her home. I got her tested and it turns out she has COVID-19. So she's going to be out for 10 days. So what do you do now? So it's Wednesday. Molly was there Monday and Tuesday. And, she didn't have much of a sniffle then. But, by Wednesday she wasn't there and you're getting this call Wednesday night. So Molly's in a small group with 6 other kids and 1 staff member, but the normal staff member was there on Monday and then she was actually, she had something. So another staff member subbed in on Tuesday. So your usual 4-year-old person was your 3-year-old person that day. And then even though Molly's in a small group, that small group eats lunch at the same time and goes outside at the same time as one other small group. So there's seven kids in that small group. So what do you have to do right now? It's 10 p.m. on a Wednesday. So right now is when those contact logs are going to be so nice to have. So if you're lucky and you have good contact logs, then you will be able to see everybody who Molly has been within 6 feet of for the last 2 days. So the way we count this stuff is we count it for 2 days before the first symptom started, or if the person didn't have any symptoms, we count it for 2 days before the positive test. So Molly tested positive today, but based on what her mom said, she might have actually had symptoms on Monday. So we actually think about contacts from Saturday onwards. Fortunately, y'all are closed on the weekend, so you don't have to worry about that stuff. But Monday and Tuesday, you have to think about who was Molly around. So Molly is in the 3-year-old group. And so then everybody, probably, realistically, all the other kids in the 3-year-old group, all 6 of them, plus the Monday staff and the Tuesday staff are going to be your first priority to call. And so, I think a great thing to do is pick up the phone and call public health and say, hey, we have a case. I hope you guys have heard about that. But anyway, this kid goes to my daycare. I have the contact logs. And if at 10 p.m. you're able to reach somebody who says, okay, great, send me all the info, I'll call them tonight, great. That may not be the reality. That depends a ton on how much the public health sort of in your area, what capacity they have, if they're able to get to you within a reasonable time frame. Because your reasonable time frame is really before daycare starts the next day. So then say, you left a message and you're not sure they're going to call you back. So you left a message with public health and now you're looking at the list of your 2 staff members and the 6 kids in Molly's class. And then you're kind of thinking, well, maybe they do share this room with the other group. So then you've also got the 8 kids in that group and the staff member. Although that staff member is really good about not getting near the kids, so maybe not. So you're going to call the 2 staff members that took care of Molly. You're going to call the rest of the kids in that group's parents. And you're going to say, you're not going to mention Molly, but you are going to say, your child has been exposed to a case of COVID-19. For privacy reasons, we can't tell you more. Your child needs to quarantine for 14 days. So that's the important information. They're going to have a ton of questions. Some of them you won't be able to answer. So I would suggest that you say, we'll get you as much information as we can as soon as you can. The rest of you don't have to quarantine, but the important thing is your child must quarantine, can't go anywhere or do anything outside of the house for 14 days. So you communicate that to the staff, you'd communicate that to the folks in her group, and then you'd probably communicate that to the parents of the other group too. what questions does that raise?
I'm not seeing any questions in the chat box.
Okay. And then Stephanie, you asked not just about what you're going to do in terms of contacting parents, but you also asked about things like cleaning. So, Molly stayed home, and she wasn't, around touching anything the day that she really had symptoms. But say Jimmy is there on Monday, and say Jimmy's Tylenol wears off around noon, and then he's got a fever. And so, you call Jimmy's parents and say, hey, he has a fever. And the parents are like, oh, really? Yeah, okay, I'll come get him. And so then, Jimmy's parents get him tested, but maybe not for a couple days. So, what do? You don't want to wait a couple days to clean the room. You want to clean the room right then. If you wait 2 days, cleaning's great, but it'd prevent anybody's actually coming into contact with surfaces. The virus doesn't tend to live on surfaces for super long. We actually don't have any known cases of people getting the virus from surfaces, but it's a really good idea to do whatever you need to do to clean the surfaces that Jimmy touched as soon as he goes home. And don't wait for that test to be positive.
Looks like Tammy was just clarifying. You said that when they're in quarantine, they can't go outside, but can they still go in the backyard of their own house?
Tammy, thanks so much for clarifying that. I should have been more specific and said that they may not, under any circumstances, be around other people. And so, when you're talking about a kid, somebody's got to take care of them. So that probably means that somebody is actually around them. But we're doing whatever we can to keep them away from other people. Certainly, definitely anybody who's not part of their household.
Adriana Diaz asks, if she leaves the city for 3 days, does she have to close or does she have to be in quarantine?
Adriana, I want to make sure that I'm understanding you correctly so I can answer your question. When I think about people traveling to a different city in Alaska, it depends a little bit on what the local regulations are. Some places in Alaska, you leave, you come back, you get a quarantine for 14 days. Most places in Alaska aren't like that. Now, if you leave the state, then you're under a totally different set of rules. And so our travel mandate is complicated, and it's difficult to comply with, and it's also one of the things that's keeping our state safe. So one thing that's really important to know is that if you or an employee or a student or a kid is coming back from travel outside of Alaska, no matter where you live in Alaska, if they're coming back from outside of Alaska, they have to do one of two things. Either they have to quarantine for 14 days, which means they cannot under any circumstances come to your facility, or they have to use the testing strategy. So the testing strategy is where people have a choice where they don't have to quarantine for 14 days, but instead they can get a test either right before they land or when they land, and then they stay away from people for a week, and then they have to get another test. And then once they get that second test and the results come back, then they can do normal stuff. But in that week that they're waiting to be tested again, plus that day or two where they're waiting for their second result, they cannot come to work, they cannot come to daycare. Definitely not. The other thing I want to mention is kids aren't required to get tested when they come back to Alaska if they go to somewhere else. So if Jimmy comes back from Seattle and Jimmy's traveling with his mom and Jimmy's 3, he doesn't have to get tested. But he has to follow what his mom does. So the kids follow the pathway that the parent that they traveled with or the person that they traveled with does. So if mom's quarantining, then Jimmy quarantines for 14 days. If mom's testing, then Jimmy can't come back to daycare until mom has gotten that second negative test.
That sounded pretty important. Can you say that one more time? Just about
Yeah,
how Jimmy now
totally.
has to wait on
This
his
is
mom's
complex.
test.
Yeah. So, kids, when they travel out of the state, and when I say kids, I mean kids under 10, but I'm pretty sure the majority of y'all's kids are under 10. So, when a kid comes back through the airport, they are going to offer to test mom and dad, or mom and mom, or whatever, whoever the kid's traveling with, but they're not going to test the kid under age 10, right? So then the parents are going to be on what we used to call minimal interaction status, and what right now we call, I cannot remember what we call it right now. But anyway, like the parents are, or whoever he traveled with, they're waiting for that second test. So they need a second negative test. They need the negative results from that back after 7 days, so minimum 7 days, usually longer than that, where they cannot go to work and they cannot do anything else. They can do a couple things that are limited, but they can't. And if the child is traveling unaccompanied, it probably means they default to a 14-day quarantine. That's a great question. Because if you don't, you can test a kid. There's no medical reason why you can't test a baby. We test babies all the time. But if the kid isn't getting tested, then the kid's going to default to 14-day quarantine. The only time the testing stuff matters is if the kid is traveling with somebody who does get tested, then they can kind of like you piggyback on their status. They don't need to get tested, but they do have to wait that period of time until their guardian or their parent or whoever they traveled with, has to, when they can go back and do normal stuff, only then can that kid come back to daycare.
So maybe an important addition to those morning attestations would be, have you traveled outside of Alaska in the last 14 days or 7 days?
Yeah. I'd ask for 14 because then, and they can explain, yeah, it's been, it's like I got back 10 days ago, but I got my negative test yesterday. Super cool.
Okay, great. That's really great feedback for everyone. The next question, if mom tests positive, does the child isolate? If they isolate for only 14 days for mom's positive, couldn't mom pass the virus to them on day 10? So they return within 5 days of getting the virus. And that comes from Carissa Castle.
Carissa, I'm so glad you asked this. And I want to break this down into a couple different situations. So I think about quarantine being 14 days, and quarantine is what we do if you've been around somebody with the virus, but you haven't tested positive yet. And then isolation is that 10-day thing that we do where we keep you away from other people for 10 days after you test positive, or if you have symptoms, 10 days from that first symptom. So say mom's coming back from Texas, hasn't had any symptoms at all. She's traveling with Bob, who's her kid, and mom gets that test at the airport, and what? She's positive. So now mom, because she has it, she's on isolation status. So she has to isolate for 10 days. And so then, and this gets really tricky. So then the question is, does Bob stay with mom, or does Bob have another option? So if Bob has another person that he can live with, maybe there's another parent, or maybe there's grandparents or whatever, then Bob can get handed off to the people that don't have COVID. And so then his quarantine starts the last day he has contact with his mom. If Bob, most of the time what happens is Bob doesn't have another easy person to hand off to. And so Bob is actually going to stay with his mom. And Bob's quarantine doesn't start until his mom comes off isolation. So what we actually do is mom is isolated for 10 days. And remember, she has no symptoms. She just traveled to Texas, came back, had a positive test. This is grim, right? So she's got 10 days where she has to be isolated, and then she can return to doing normal stuff. But Bob's been isolated. Bob's been on quarantine for 10 days already, but the 14 days of his quarantine don't actually start until the last day that he's exposed to the virus, which we call the 10th day of mom's isolation. So Bob's actually going to quarantine for 24 days because it's 14 after mom tested positive. So that is one of the problems with COVID, and that's one of the tricky situations that your kids might find themselves in this year.
Tricky, tricky, tricky. Okay, so this is going to be the last question, and it's coming from Alyssa Police. I'm glad you talked about travel. If a family member visits a child's household, we require that child to also remain out of the center until the traveler fulfills the mandate. However, if the family member departs before they can even test a second time, can the child then just return at that point? That's a good question.
Yeah, so Alyssa, I'm glad you asked this question. So the way I'm reading this is that what the travel mandate says is the person who traveled has to stay away from other people. And it does not require other people in the household to isolate or to quarantine. It just requires the traveler to stay away from other people. And it allows travelers to stay with their household. So what I'm interpreting this as is your facility has an additional policy. And your facility's additional policy is that if you have somebody who's on quarantine or quarantine because of travel or isolation because of travel, then that kid can't come to daycare. And I think it's a reasonable precaution to take. Not every facility is going to take it. So then when you let that kid come back is going to be up to your facility's policy because it's not something that facilities are required to do.
Great. Thank you so much for all of these answers to all of these pressing questions, Dr. Ohlsen. We really, really appreciate your time on behalf of THREAD and the board of directors. We want to wrap it up now. So if there are any other questions, let us know. But otherwise, thank you everyone so much for joining tonight. We hope that everyone got a lot of pearls out of this. And if you have further questions, you know where to reach out. And you can find a recording of this on THREAD's website.
Thanks for having me. Take care.
Thank you. Have a great evening, everyone.
Thank you so much. Good night.